U.S. Health and Human Services Secretary Robert F. Kennedy Jr. has dismissed all 17 members of the CDC's Advisory Committee on Immunization Practices, ACIP, signaling a dramatic overhaul of the nation's vaccine policy structure. The move follows Kennedy's promise to restore what he calls transparency and independence to a panel he claims has become too aligned with pharmaceutical interests. The ACIP plays a critical role in shaping which vaccines are recommended for Americans and covered by insurance programs. By removing every current member, Kennedy has effectively frozen the committee's operations ahead of a key meeting later this month. He indicated that a new slate of experts will be appointed, aiming to bring a broader range of perspectives and less industry influence to vaccine decision-making. In tandem with the shakeup, Kennedy also announced a rollback of certain COVID-19 vaccine recommendations. Specifically, the CDC will no longer advise routine COVID-19 vaccination for healthy children and pregnant women. He argued that available data do not yet support repeated boosters in these populations. Health professionals have expressed concern over this change, warning it could reduce protection for vulnerable groups and erode public confidence. The decision to bypass the usual advisory process has stirred backlash among health experts, who fear that sidelining seasoned scientists could weaken evidence-based policymaking. There are additional concerns that changing the vaccine schedule without ACIP input could affect insurance coverage and access to vaccines, particularly for families reliant on government programs. Further controversy emerged after a senior CDC vaccine official resigned, reportedly in response to the changing guidance and uncertainty around leadership. With the CDC still lacking a confirmed permanent director, Kennedy's sweeping changes are unfolding at a time of institutional instability. The next ACIP meeting, scheduled for late June, will likely serve as a test of Kennedy's commitment to building a credible, transparent advisory process. As the Biden and Trump administrations both previously relied on ACIP guidance for national immunization plans, this sudden and full-scale dismissal sets a precedent that could have long-term implications for public health policy in the United States.